Do you know what is the biggest confusion that I faced during the last 25 years in medical affairs? It's the confusion surrounding two concepts. The first concept is the alignment of medical strategies with the business goals. And the second concept is the medical independence in the pharmaceutical industry. So, ladies and gentlemen, in this episode, we will try to resolve this conflict and any misunderstanding behind these two concepts: the alignment of medical affairs strategies with the business goals and the independence of medical affairs in the pharmaceutical industry. Let's start by explaining both concepts. The alignment of medical affairs strategies with the business goals is a concept that ensures that the medical strategies that we develop in medical affairs supports the overall objectives and goals of the pharmaceutical organization that we are working for. It has a challenge, and the challenge is the balance between the scientifically based decisions and the commercial interest of the organization. And that's why medical affairs colleagues needs to have a mature balance between the scientific merits of the strategies and the commercial interest of the organization. And we will come to this point in details in few minutes. So the objective is to ensure that the medical strategies that we have in medical affairs is supporting the business goals. The challenge is to create this balance between the commercial interest from one side and the scientific merits of the medical strategies from the other side. It is very important when we talk about alignment of the medical strategies with the business goals to stress on how important this alignment is. Because without this alignment, the medical affairs function will work in silo. And without this alignment between the medical strategies and the commercial objectives, the medical function or the medical colleagues teams will never be able to demonstrate the business impact of their work or their initiatives. The question is, if we agree that we need to align our medical strategies with the organizational or the business goals, how can we do that? One is based on science and the other one is based in commercial interest. How can we align both together? Let's have some examples in order to illustrate this. Let's say that the commercial marketing strategy is based on expansion in one market. The medical strategy should be to enhance the awareness at the professional level, the healthcare professionals, as well as the patients. Let's say that the commercial strategy is based on differentiating the medication or the product from competitors. Then the medical strategy should be focused on the value proposition of the medication. Let's say that the commercial strategy wants to increase the volume of the users or the prescriptions. Then the medical strategy should be focused once again on increasing the awareness level at the patient level. If the commercial strategy is to launch or to accelerate a product launch, the medical strategy should be to accelerate data generation and the data dissemination. And that's how the medical strategy can support the business goals. If you are enrolled in the strategic thinking for medical affairs course, you will see and find a lot of examples like this. However, now let's focus on the main takeaways from this discussion about the first concept, which is alignment of the medical strategies with the organizational goals. This alignment is a must. Without it, medical affairs will work in silos and it will be very challenging for them as a team to demonstrate business impact and will be perceived as dreaming away and doing efforts. Yes, the efforts are appreciated, but sorry, they are not tackling an important business issue. It is important how we do it. We need to understand and utilize our scientific expertise in order to see which medical strategy can support the commercial or the business goals. Now, let's talk about the next concept or the second concept that is creating also a lot of confusion, which is the medical independence. The medical independence is a concept that was established in the big pharmaceutical organizations to maintain the autonomy of the medical decisions and recommendations from any commercial influence. The challenge here is upholding the integrity of medical affairs and scientific research in an environment that is influenced mainly by business outcomes. Why medical independence is important? It is important because it ensures that the patient care and outcomes, as well as the integrity of medical research, remain uncompromised by the business or the commercial interests. And that's where we talked about the balance between the scientific merits and the commercial interest. And also, we talked about how important that the medical decision maker must have this skill or capability to maintain the balance and to ensure that the medical decision making is independent of the commercial interest. Now, let's have another example in order to illustrate the importance of the autonomy of medical affairs, especially when it comes to decision making. Let's say that the medical affairs team has been informed that the marketing strategy is to accelerate the market penetration of a product, a new one. When the commercial team communicates this strategy to the medical affairs, then they need to leave the medical decision maker free to take the right action and make the right decision. The medical affairs decision maker must be independent of the commercial influence while making the decision. This way, the medical team will have the autonomy to select which medical strategy can best support the commercial strategy without compromising on the medical integrity and the medical independence. Another very common scenario in the pharmaceutical industry, whenever the commercial team asks the medical to come and support to them presenting something about a product in order to differentiate it from competitors. Yes, they are requesting this based on the commercial language. However, in the medical interpretation of the request, they need the medical value proposition that puts this product in a better position than the traditional or the conventional treatments. So we need to have the medical expertise in order to always make the balance. Yes, we can present data to a committee or to an entity that shows that the clinical research and the medical research has demonstrated these facts and these benefits of certain product. As long as we don't involve the medical team in price negotiation or the contract discussions, the medical team can always present the value proposition of the product that is based on the substantiated evidence that was collected from data generation or real world evidence, and always maintaining the scientific merit in their discussions and presentations. So it seems to me that the solution for this confusion that we talked about in the beginning, that is surrounding the two concepts, medical strategies being aligned with the business objectives and the medical independence. The solution is as simple as establishing a state of balance between the scientific merits of our strategies and the commercial interests of the organization. So we need always to establish the link or the bridge between the commercial strategy in its commercial language and the medical strategies that can best support the commercial strategy. And we should not expect our commercial partners and colleagues to speak to us and request from us the support in our medical language. So they will not come to us and ask that they need certain type of evidence, or they want us to present the scientific value proposition or enhancement of the patient outcomes as shown in. They will tell us simple commercial terminologies sometimes that they need to differentiate the product from a generic or from a competitor. We have to make the link and to make the bridge between this language and this strategies and what it means in medical that can best support these objectives. So thank you very much for your attention and see you soon. Bye.